we are going to discuss a case study. Smile Again. It's a dental clinic case study. Uh, the case, it starts with the story of the challenge what they have been facing in 2019. Initially, they started as a clinic. Later, they found difficulties and challenges in improving the patient engagement because the competition has drastically increased. New entrants of clinics, hospitals came into the public sectors. So they found some challenges. So how to improve the customer? I mean, customer in the sense the patient's engagement. So that design thinking approach they adopted it, and how they been successful in the clinical thing. Okay. So let me ask you that what are the key points in the current patient experience? I mean the pain points of customer experience, patients in Smile Again.
First point, administrative follow-up issue. Administrative, in the reception, the unskilled receptionists are not communicated well to the client. And follow-up issues. After the appointment booked, they did not call the patients and not clear about the needed. Second one is emotional and psychological barriers. Undefined treatment with lead to fear meditation.
Right, how the design thinking can be applied to understand the patient needs and preferences?
I would like to answer. First, to understand the patient needs, we are approaching it through a human-centric process, and in that we choose empathy as the first stage, as it is a first point of design thinking. In first empathy, we are observing patients, be it actively or passively, and we are asking surveys from them. And for example, we are gathering details about their pain points as well, like Priyadarshini mentioned. For example, they are experiencing say any uncomfortableness in their environment. We are considering it also as an activity, and we are taking that into consideration. So using that empathy, we are going and moving into the defined stage. In this defined stage, information is gathered from the empathy. We take as it, like, and we are defining it like patients are dissatisfied with so and so problems, and patients during examination, patient feel ignored or patient feel anxious, etc. And we define what's the problem, and using those definitions, we are taking into the next stage, that is ideation. In ideation, we are proposing our ideas to the stakeholders of, who are related to this dental community, and we are also including not only stakeholders but staffs as well as our users ourselves. We are including everyone to give us the possible solution, and brainstorming those solutions.
That are the implementation.
Implementation.
Right, good answer, Kasani. And how to enhance the patient experience, what kind of innovative solutions can be introduced?
They should implement design thinking program to staff to train staffs and the dentist. They can also introduce the app-based digital apps to enhance the patient experience. And they can also allow the patients to write digital feedback so that the new patients can go through the feedback and get an idea. And they can also have improve the process so that the confusion based on it will be minimized.
All right. So what the Smile Again, they can take measurements in impacting the patient satisfaction. What kind of
measuring the impacts of Smile Again, that will be pre and post innovation surveys tracking improved in satisfaction across the key touchpoints, retention rate measuring repeat visiting of patients, net promoter scores as to patients would recommend the clients, and reduce unuseful social media.
Yes, well said, Nishant. And what role the empathy in design patient-critic solutions at Smile? How the empathy mapping can be customized or made it more flexible for this?
So empathy is an heart of the design thinking process. Here it plays a vital role in to know the patient's needs and preferences to for the organization. Like Priyadarshini said, the pain points are the customer's unsatisfaction with the staff behaviors and unprofessional behaviors and also long waiting time. We can minimize it using the design thinking processes as Suhashini said, and also we can implement further process like Bhandri Madhika has explained us to enhance it and to give the customer their satisfaction.
Good on Aishwarya. So, how can Smile Again scale its design thinking approach across multiple dental cases?
I think Smile Again can use the recent first they should create a simple step-by-step to understanding the patient problem and finding ideas, testing and improving. Then they can train the one person from the clinic who can teach others. This will be helpful to spread this method easily. In each clinic is different, so they should adopt the changes based on what the patient in that area need. For example,
That's fine. I want the conclusion with the insight. Maybe something from advantages or somebody can tell it. If there are 1,000 patients in a specific zone or area, how many dental care hospitals can be established? If 1,000 patients, how many dental care hospitals can be set up?
Minimum of 10 plus hospitals are needed, sir, because the 1,000 patients, it is crucial because there will be only a few set of dentists as well as their assistants and accompanying staff. So we need everyone to work as a team in order to make some customer or patient satisfied. And this industry is very patient-centric as to we need to make their experience as satisfiable as possible. So implementing design thinking and identifying pain problems and coming up with more solutions as other people say, it is very crucial. And implementing this worldwide also will be helpful as not only those 1,000 people in a particular area, but worldwide they can benefit from this.
Good one. Was a good reading.